Our group and our colleagues in Germany, Dr. Ainsley's group, Dr. Rashe, and Mohammed Kemal Samour on our side, have both described a single case experience in two very good publications showing that in each of individual cases, BCMA loss has been the cause of relapse and or resistance to subsequent retreatment with CAR T cells. Now, BCMA was thought to be considered as a target, which had two very important characteristics. One characteristic was that it is present on only or mainly myeloma cells, normal plasma cells, but no other target, and which makes it a very good target with minimal toxicities or off-target effects or other effects in other organs. The second component why it was a good target is because BCMA has a functional role in myeloma. BCMA, through its ligands, APRIL and BAFF, transmits signaling, NF-kappa-B related, to induce proliferation, growth, and survival of myeloma cells. And so BCMA was required for myeloma cell survival and growth. And because of that, loss of BCMA may not be a most frequent occurrence in this disease. That's what was thought, and that makes it another good example of a good target. However, our studies have shown that, yes, myeloma cells can survive without BCMA, and these two cases are anecdotes. They're not generalized. And we do believe that this mechanism of resistance may not be the most frequent. It's going to be more uncommon, at least at the present time. But fact that it can survive like this, and fact that we have many BCMA targeting treatments coming up, it's quite important to consider what do we do in that scenario. Now, another important finding that Dr. Mohammed Kemal Samour has also published recently is that BCMA is present on 16p chromosome, and chromosome 16p is where loss of it can lead to loss of BCMA. And in his patient that he described, that particular patient had loss of functionally or physically loss of 16p on both the chromosomes, the BCMA locus. And he also found that the 16p deletion is also quite commonly associated with 17p deletion or other way around. So we have a lot of learning to do to see if the 17p, is it where loss of BCMA may be more common? I don't know that today, but we will know very soon. So having all those data tells us that we need to come up with strategies to target BCMA and beyond. So what are the strategies to overcome BCMA loss and for therapeutic purpose? The easiest answer is go to some other target. So there are at least two targets, valid targets already in clinical study. Both of the targets, GPRC5D ends up being one of the target that has really gone on to having both CAR T cell investigation and also bispecific investigation. And the second target is FcRH5, which already has a bispecific. Hopefully, a CAR T may come about too, and similar other targets. So that's one strategy, looking alternative. The second one is that instead of using BCMA alone, we might end up using more than one target, combination of the ones which I mentioned or a few others, to make it more specific, and that loss of BCMA may not become an ultimate endpoints of some of the progression in this patient population. And so I think that's second important point we have to consider. And number three, if you're going to use BCMA targeted treatment, we want to do the best the first time. And so we have to select what we select in the patient population, etc. So there are strategies already in evolution that are meaningful. Another strategy which is being evaluated is to combining BCMA CAR T with gamma secretase inhibitor. And gamma secretase is a molecule or an enzyme that cleaves BCMA from the surface of myeloma cell and leads to soluble BCMA. So if you inhibit it, there is more BCMA on surface, and then myeloma cells can become better target. And there may be setting where we may or may not get loss of BCMA as a possible infrequent occurrence for resistance, etc. So those are studies also ongoing, combining gamma secretase inhibitor with anti-BCMA CAR T cells. And so I think there are multi-pronged attack in first preventing BCMA loss as a mechanism of resistance, and number two, overcoming if there is a loss by other methods. And I think each of these are very exciting, has great potential. And I think in the end, in very near future, we may come up with an answer to prevent and or overcome BCMA loss in myeloma and still get good therapeutic outcomes.